Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Catherine Dow. Dr. Dow is a cardiologist.
Hi everyone, I'm Catherine Dow. I'm a non-invasive cardiologist. I have a particular interest in women's heart health, and I'll be talking today about strategies that women can empower themselves with for prevention and recognition of cardiovascular disease. So my talk will center around three main components. Number one, I'll define the problem. We'll discuss the scope of the problem of cardiovascular disease in women, different risks that women should be aware of so that they know that they are a risk, and things that you can do to minimize your risk if you do have a higher risk for heart disease. So heart disease is the leading cause of death in women in the United States. Half of women will have heart disease in their lifetime, and more than 500,000 women die of heart disease each year. This is more than lung cancer, breast cancer combined. It's actually 7 times more common than breast cancer. And the unfortunate thing is that it doesn't get much of the attention that some of the other conditions get. It's often under-recognized and undertreated. And despite improvements in the overall care of heart disease in the last 50 years, more women than men will die of heart disease, and this has been a staggering statistic since 1984. So why is this such a major finding? Why are women underdiagnosed? Why are they undertreated? Well, women, number one, are often more likely to have certain traditional risk factors for heart disease, which include obesity, high blood pressure, high cholesterol, and diabetes. And women themselves are less likely to know that they have heart disease. Traditionally, it's been thought of as a man's disease, and when you think about people who've had heart attack, you always see this picture of a man clutching his chest, an older man. And women that have some of the same risk factors and have, as I said, as higher risk of death related to it. Often women's complaints are not taken as seriously as men's. Some of the symptoms that women present with can be different than a man's symptoms. And women often are not really thinking of themselves or taking their own symptoms seriously. They often, just on a general sense, don't really prioritize their health because they're usually the caretakers of their family, caretakers of their children, their husbands, their spouses. And so they don't really think about themselves first. When I mentioned the symptoms that can be different, while the most common symptom for both men and women is chest pain, chest pressure, or discomfort, oftentimes women will have non-specific symptoms which can make it more difficult to diagnose. So symptoms such as extreme fatigue, shortness of breath, or indigestion, or just a feeling unwell that's very poorly characterized. This may be related to just overall hormonal changes, hormonal differences between men and women, and also the fact that women in general are smaller in stature, their hearts are smaller in size, their blood vessels are smaller in size. So while the symptoms are the most common symptom is chest pain, more often than not, women will have other symptoms that are just as concerning and often need to be recognized in order to pursue the appropriate testing to make the correct diagnosis. So in terms of understanding whether or not you're at risk, you need to know what the risk factors are. And so there's 2 main types of risk factors, those that are non-modifiable and those that are modifiable. So the non-modifiable ones are the ones that you can't change, but you need to recognize. Number 1 is age. It's an unfortunate consequence of getting older. Your risk of heart disease goes up as you get older. And the second thing is your family history. So first degree relatives are usually what we think of when we're thinking about family history. It's your mom or your dad, your brother or sister, or even your child. It's a first degree relative who's had heart disease at an early age. So that would include a male relative, father or brother, who has had a heart attack before age 55 or has been diagnosed with significant coronary artery disease before age 55, or a mother or sister who has had a heart attack before age 65. And the reason why there's a difference in age is it's thought that there are some protective effects of estrogen that allow the presentation of heart disease to occur later in women than men. The modifiable risk factors are the ones that you can actually do something about, and those are the ones that you really need to recognize in yourself and get treated, because they can be treatable and lead to prevention of cardiovascular disease. So most risk factors are luckily modifiable. They include high blood pressure or hypertension, a history of smoking, high cholesterol or very low good cholesterol, which is the HDL, diabetes, and obesity. And in women in particular, that's the waist circumference of above 35 inches can lead to an increased risk of cardiovascular disease. So we talked about the types of risk factors, but then you also need to know if you're at high risk or at risk. So patients who are at the highest risk for cardiovascular disease are people who already have established coronary disease. So if you've already have had blockages diagnosed in your arteries, have had a stent placed, or have had a heart attack previously, then you're at high risk for a future event. If you've had a stroke, you have peripheral vascular disease, which is blockages or atherosclerosis in the arteries of the legs, in the arteries in the legs and the arms, or aorta. If you have concurrent kidney disease or diabetes, you're at very high risk for cardiovascular disease. And so if you have some of those non-specific symptoms or the atypical symptoms that I have described, you should be thinking about whether or not you might have also coronary artery disease. And then people who are at risk are the ones who have some of these modifiable risk factors and that I had just discussed. So high cholesterol, tobacco smoking, obesity, a poor, real sedentary lifestyle, or if you have known coronary calcifications, which are calcium deposits on the walls of the arteries. So by recognizing whether or not what your risk factors are, and then knowing if you're high risk or at risk, that can help you yourself understand whether or not the symptoms that you have should be taken really seriously, and it helps the doctor also decide the appropriate treatment plan or plan for diagnosing your symptoms. So in terms of what you can do for preventing heart disease, the number one thing that you can do is stop smoking if you're a smoker. That's the number one modifiable risk factor, and that's the number one thing that women and men can do to improve their cardiovascular risk. The good news is that overall smoking has declined overall, especially in older women, but younger women are still smoking, and there's a whole new population of younger children, younger generation of patients who are starting to smoke things like vapes, Juul, some of these new devices that are touted as ways for smokers to stop smoking. They're actually coming out with flavors like, flavors named in fancy names, things that are really attractive to younger kids, bubble gum, unicorn flavor. So these things are attracting a whole younger generation of smokers, and it's increasing. The concern is that it's going to increase cardiovascular risk in that generation in the years to come. But going back to smoking, women who smoke tobacco are 2 to 6 times more likely to suffer a heart attack, and 3 times more likely to die of a heart attack than women who don't smoke. And just 1 to 4 cigarettes a day can really increase the risk of a heart attack. So by stopping, you can actually just decrease your risk of smoking. For stopping for 15 years, former smokers can decrease their risk of heart disease to that of people who don't smoke. So if you smoke, you should stop. And obviously it's very challenging to do this. If it was so easy, people would just stop right away. And so some of the strategies that you can think about for reducing or for motivating you to stop include, number one, just being really proactive. Start by picking a date on the calendar, making that the date, making that a goal for you, and including your loved ones in the journey. So if your partner and family and your friends are aware of what you're aiming for, that can definitely help be a motivation. Joining a support group can help, and then sometimes thinking about other strategies that your physician can help you with. So behavioral therapy that can be prescribed by a mental health provider or a primary care provider, and then other pharmacologic therapies or medical therapies like nicotine replacement in the form of chewing gum or patch, or there are certain medications that can actually be very effective at helping to stop smoking. Some that come to mind include bupropion or Wellbutrin and Chantix. So the next very common risk factor is high blood pressure or hypertension. And hypertension is a very common condition in the world, and about a third of all Americans have high blood pressure. So the first step is to really know your numbers. And so the definition for high blood pressure has changed recently, and providers are targeting more aggressive or strict guidelines for control of blood pressure. So normal blood pressure is considered a systolic blood pressure top number of less than 120 and a diastolic or bottom number of less than 80. Borderline blood pressure is actually now defined as 120 to 130, and then type 1 hypertension is between 130 and 139. So this used to be the borderline zone, but now cutoffs of 130 or above are considered hypertension. The traditional sense is high blood pressure is a systolic blood pressure of a greater than 140. So if you're already in this high area, you really need to be on some kind of medications for treatment of your blood pressure. And if you're in the more borderline zone or the traditionally borderline zone, you should be thinking already about strategies to lower your blood pressure. And with blood pressure, we call it the silent killer because it's often something that presents when people are asymptomatic. So people can often have high blood pressures and not even know that they have high blood pressure because it's not something that you generally feel. It's maybe when you have really high blood pressures, you may feel some symptoms like headache or chest pressure, but oftentimes people will have higher blood pressures and not even know it. And the only way you can really know is if you're checking. So it's important to know your numbers. If you already have borderline or high blood pressures, it might be a good idea to invest in a blood pressure cuff and start measuring your blood pressure at home on your own. And another really concerning fact is that the majority of people with high blood pressure who are treated with blood pressure medications actually are being undertreated, and so their blood pressures are not at goal. So when you're checking your blood pressure, an important way to treat or to measure your blood pressure is by sitting for about 5 minutes, resting, having your arm at the level of your heart, keeping both feet on the ground before checking, because there's obviously going to be very big fluctuations in your blood pressure all day long. So it's not a good idea to just check your blood pressure as soon as you are done doing something stressful or doing an activity. To get a more accurate reading, you should be resting for about 5 minutes, sitting in that position before checking. But write down your numbers and bring your numbers to your physician's office when you get checked. Oftentimes, you might check it and you may remember a range, but it's actually more helpful if you can write it down so that we don't get mixed up with mix-ups in your memory, and you actually have a documented, written out journal of your blood pressure readings. When it comes to blood pressure, things that you can do on your own to try to lower your blood pressure include limiting your sodium intake, limiting the amount of alcohol you take, limiting your serving sizes and what you're eating. Make sure that your weight is at a healthy weight, and staying active. Those are all really easy, not easy, but just things that people can do to keep their blood pressure down. And then if your blood pressure is still really high or above the goal level, despite the lifestyle changes that you make, you may need to start antihypertensive medication. So the next risk factor that I mentioned is high cholesterol. So again, it's important to know your numbers. When it comes to high cholesterol, we look at the total cholesterol and then some of the other particles in the cholesterol panel. So a total cholesterol is considered high if it's very high if it's above 240, and good total cholesterol is if you're under 200. So 200 is a really easy number to remember, that your total cholesterol should be under 200. But looking at the other numbers, you have something called an HDL, which is the good cholesterol, and LDL, which is the bad cholesterol. So LDL is something that I tend to target mostly because there's a lot of data, a lot of research studies that show that lowering the LDL to a really low level can help decrease cardiovascular disease. It can help in primary prevention, which is preventing the first presentation of a heart attack or heart disease, and secondary prevention, which is preventing a heart attack in someone who's already had a heart attack. So I often target very low LDL numbers, less than 100, and then HDL, which is a good cholesterol, you generally want it to be as high as possible. But a high HDL by itself shouldn't be just thought as something that it's going to protect you, and you don't need any kind of lifestyle interventions or medications, because we know from studies that the LDL, which is a bad cholesterol, seems to be more linked to bad outcomes. Triglycerides is another particle that's often measured in the lipid panel. We aim for a triglyceride of less than 150. Triglyceride is often determined by your diet and what you're eating, and so sometimes just lifestyle or dietary changes can really help decrease that. So 40% of women above age 20 actually have high cholesterol. It's important to know what kind of goal numbers you should be aiming for, and then what you can do to decrease your risk. So maintaining what we call a heart-healthy diet, exercise, regular exercise, weight loss, and thinking about medications if you're not really at goal. So the next is your blood sugar. So a lot of patients have diabetes and have pre-diabetes. Well, diabetes is officially defined as a fasting blood glucose of over 126. And when your fasting blood glucose is between 100 and 125, that's considered pre-diabetes. We also measure something called hemoglobin A1C, or your primary care doctor might be measuring that in people who have pre-diabetes or diabetes, and that measures what your overall, gives you doctors a sense of what the overall sugar levels have been in the prior 3 months. If your hemoglobin A1C is high or greater than 6, that's in the diabetes range. And so your diet should be the first thing that you're thinking about when you do have pre-diabetes or diabetes. And then if your diabetes is poorly controlled, certain medications can really help decrease your sugars. So when I talk about diet, what do I mean? What's a heart-healthy diet? So this is very similar to what the classic Mediterranean diet is. It's one that's high in fiber and plant-based foods, greens, vegetables, things like peas, legumes, beans, whole grains like quinoa and brown rice, and types of proteins that are lean, like the protein that you can find in tofu, nuts, chicken breasts, or fish. And really limiting intake of red meat and high-fat dairy or trans fats. So these are the types of fats that are solid at room temperature, your butter, your cheese, cream, red meat like fatty pork or beef, and limiting processed foods, so things that are made and packaged. So those tend to have a lot of preservatives, they have a lot of sodium in it, things that come generally from a box or a can or a bag or something that's not that was previously prepared. So the Mediterranean or heart healthy diet is something that you really should stick to. And similarly, if you have issues with your sugar or impaired fasting glucose or diabetes, prediabetes, and then thinking about avoiding certain carbs, like really sugary foods, heavily processed foods like breads, pasta, rice, potatoes, etc. So those should be avoided if you have diabetes. Like moving on to physical activity. Physical activity is really important for overall cardiovascular health. It can improve not only heart health, but bone health and mental health. It often improves self-esteem, improves sleep, helps the heart to be more efficient. It can indirectly lower the blood pressure, lower cholesterol, lower stress. So in terms of guidelines for physical activities, the American Heart Association recommends 150 minutes of moderate intensity exercise once every week. And so that would be 5 days a week of 30 minutes of something that is involving all your major muscles, allowing you to break a sweat, getting your heart rate up. And so that's 30 minutes 5 times a week. You know, people often ask, is there such thing as too much exercise? And there probably is, but the majority of people are not doing enough. And so this includes more than just the casual stroll around the neighborhood. You really want to be doing something to get your heart rate up, get your muscles moving. I often say just something that makes you break a sweat. So climbing the stairs, doing a light jog, maybe going up a hike, biking, etc. So like I mentioned, everyone probably needs to do a little more exercise, and it can be challenging to incorporate exercise in your daily routine. And so in terms of tips that I recommend include just in general actively thinking about ways to bring exercise into your life, because when you're thinking about it, you're more likely to do it. And so you should choose activities that you actually enjoy and find people who can do it with you, people that you like being around, and you can do it together as a team. So find a workout partner, maybe use technology if that's part of your life to incorporate fitness into your life. That may include an Apple Watch or fitness tracker, using your mobile phone, wearing some other kind of wearable. This can allow you to track your steps. Sometimes there can be nice rewards, internal rewards that your watch can say, like, you've reached your goal. It can set you reminders to get up and move around. And when you're actually exercising, you should be planning in advance, making sure that all the equipment that you want is in the area that you're going to work out in is nice and clear, that you have any kind of weights or jump rope or any kind of bands that you have, equipment that you have ready to go. Make sure you have water there. Just plan in advance so that any kind of barriers that might come up, you're already thinking about it and thinking ahead to prevent any barriers from getting your work accomplished. Another important risk factor that I didn't really discuss is emotional and mental health. So mental health issues are often underappreciated in women in particular, since this talk is among women, but men also. And so unfortunately, cardiologists often will neglect this because cardiologists typically are good at looking numbers like blood pressure and cholesterol, but when it comes to anxiety and mental health disorders, they're not so great about talking about it. But it is a really important issue, and actually during my fellowship I did a little bit of research on the presence of mental health issues like anxiety and depression in elderly patients, and the numbers are really staggering. It's They're highly linked to heart disease, and a large number of elderly patients have heart disease. And there are research studies that have shown that treatment of depression and anxiety can lead to better outcomes, especially like after heart surgery, for example. And part of the reason why this is such a prevailing issue is that when people have these kind of conditions, they have increased stress, which can increase stress hormone levels of cortisol, can increase blood pressure, heart rate. It can often lead to sedentary behavior, leads to other physical ailments such as poor sleep, headache, back and neck pain, palpitations, and often leads to unhealthy behavior. And it's well known that depression and just in general lack of social support are more common in older women. So if you do have any kind of issues such as depression or anxiety, it's really important to get help, to get that treated, to number one, be aware, because just being aware of the problem allows you to be more proactive about the next steps in terms of treating it. There are a number of strategies that are available for coping with mental health disorders. Number one, just some general tips include forgetting, not trying to be perfect all the time. That leads to undue stress, undue expectations that just are not realistic. Thinking about the triggers for stress and anxiety, and then targeting those particular issues directly if that's possible. Different therapies or just things that you can do at home may include relaxation, meditation, yoga, finding a hobby or something that you can do on a regular basis that keeps you occupied, maybe being around people that make you happy, getting a support animal. Sometimes just having a therapy dog can be really helpful in some people. And then when those kind of issues become too hard to manage, understand that it's totally okay to seek professional help, and probably is in your better interest just to go ahead and get professional help if you can, because treatment of depression and anxiety does help lead to better outcomes in cardiovascular disease in particular. So a few therapies that are options include cognitive behavioral therapy, and so this is a type of therapy that a trained provider can help you with. The idea is that when you're thinking negatively or thinking about certain things in a negative way, that can translate to, so the way that you think translates to the way you feel and then the way you act. And so if you're thinking negative thoughts, that can lead to negative feelings and negative physical issues. When you can retrain or reframe the way you're thinking, reframing some of these negative thoughts, thinking about something that makes you anxious, and realizing that you can maybe think about it in a positive way, that can actually subsequently affect your physical health in a better way. So one example would be if someone's really anxious and they just feel like something bad's gonna happen and they get a phone call in the middle of the night, maybe their first reaction would be, oh my gosh, what happened? Is my relative sick? Why is somebody calling me in the middle of the night? And so that anxiety translates to, physical this negative thought translates to something physically bad. But in reality, you don't really know what the phone calls were. So even before picking up the phone, if you're already having that negative thought, it's translating to how you feel physically. So reframing your thoughts would include, the phone call comes, maybe it's not such a bad thing. Maybe it's somebody who wants to reach you and wants to chat because they miss you, or, et cetera. So that's just an example. So CBT is a very common and well-established treatment option for people with a lot of anxiety and depression, and it's a non-pharmacologic way of treating some of these, negative thoughts. MBSR, or mindfulness-based stress reduction, is another type of technique that some providers can provide, and the whole idea is to increase the awareness of the body's functions, feelings, and consciousness. And this also helps to alleviate anxiety, stress, and depression. So I also mentioned that just in general having good relationships in your family and in your life, because relationships really can affect your own mental and physical well-being. Healthy habits spread through your social network. Bad lifestyle choices and good lifestyle choices are like persist in your company. So your social circle will often influence your behavior. And so there have been actual studies that have shown that women who regularly spend time with close friends live longer and have less heart disease. And so think about those relationships in your life. Find and build a supportive network if that's possible. And when it comes to toxic or unhealthy relationships, disengage in those, because those negative relationships can really put a toll on your mental well-being and your physical well-being. And you should also do your part. So you similarly might be the support for someone around you, and you can listen and actively engage and participate in these healthy relationships. Involving your family, if you have family, it can be helpful, because heart disease often affects the family too, and having support from your family can make a huge difference in terms of making the lifestyle changes that are recommended more easy. Asking your family to participate in your health decisions, letting them know what's going on, bringing them to your doctor's appointments, because sometimes they can just ask the questions for you and alleviate some of that stress and anxiety so many people feel when they go to the doctor's office. So here, friends and family are more likely to lose weight when a person close to them starts making positive life choices like diet and exercise. And that's the same as with smoking. So wrapping up, hopefully I gave you some tips that might lead you to empower yourself. When it comes to your own health, think really actively and proactively. Learn about any kind of risk factors that you may have. Learn about your condition, treatment options, the steps that you might need to take to make your therapy a success. Make the most of your doctor's visits. When you go, write down your concerns ahead of time, any questions you have ahead of time, so that you can ask your most important questions first. And you are your own advocate, so be your own advocate. If you are having symptoms that you're really worried about and you feel just that your symptoms are not taken seriously, really, push it. Don't let your concerns go unnoticed. When it comes to your goals, set realistic goals and focus on single goals at a time. Those are you're more likely to achieve your goals if you don't have a whole large list of lofty goals, because when it comes to behavioral changes, they're generally really small and incremental, and it takes time to see the changes, the benefits from what you've done. So it is important to have positive reinforcements and have small goals that you achieve, so you can actually achieve your bigger goal in the long term. So I mentioned, classical diet and exercise modification is hard because there's the time lag. There's time in between when you actually start doing your work and then when you see the quote-unquote results. So it may be more difficult to sustain certain lifestyle changes. If you have your goals be small and achievable, you're more likely to achieve success.